for the evening is Kelly Freed, and tonight we are going to be talking about what is going on in she is the Director of Mental Health Services here in Chesterfield. There we go. Thank you very much.
Thank you for having me.
Let me see.
Okay.
Turn me down. Let's see how's that?
Sounds pretty good.
Okay. Alrighty. I think it sounds a little bit better than it did the first time. Thank you again for calling in tonight. So I wanted to make sure that we were kind of staying in touch with folks. I did a show a couple of weeks ago, maybe right after the first really kind of getting in maybe a week or two into the shutdown. And now that we're, a month or 6 weeks into it, some people are getting a little cagey. So I kind of wanted to reach out to people and talk about all of these things that we're going to see cropping up, because the longer this goes on, we're going to see potentially see an increase of the things that we already see, and some of that is related to the shutdown itself, which if there was already some financial insecurity, that may be exacerbating that. We see an outcropping. We see consequences from that as people feel more and more insecure, whether it's due to health concerns, whether it's due to financial concerns, and how can we go about addressing that? What services are available to folks? How do they access them? Because things have become so limited due to the shutdown. And I feel like I'm saying all the things at once, so I'm going to babble a little bit less and let you talk to folks about how they can find the services that they need right here in Chesterfield County.
Okay, that would be great. We are serving a dual population. We just in a general sense serve individuals with mental health, substance use disorders, and those with intellectual and developmental disabilities. And that's both children and adults. And so that is our main population that we serve on an ongoing basis. But as you say, our population now is the whole general public, because everybody is being affected by this pandemic. And so there's a number of things for our particular services in general. There have been no changes in our service delivery in the sense of of individuals being able to access our services. So mental health professionals, they are on the front lines, just like public safety. Actually, we have a lot of collaborative programs together with police and fire. Mm-hmm. So there have been no changes at all to our 24-hour crisis services. These services are available 24 hours a day, 7 days a week, and that's mainly for anyone who's experiencing a psychiatric emergency. And at the end, I can give you the specific numbers for the public to have, and how they engage in each one of these. With our individuals with intellectual and developmental disabilities, staff are working 24 hours a day in our residential facilities, caring for these individuals, and really taking every precaution that we can to prevent or reduce the risk of the virus entering those facilities. And we've been very successful with that, and so we're so pleased. Though our physical building is closed to the general public, we do see individuals by appointment as needed, and of course we will do that face-to-face with appropriate social distancing. But in the meantime, we have transitioned all of our counseling services for adults and children to being provided through phone contact or telehealth options to respect the social distancing. And so anyone who is requesting services for the first time will receive an assessment the same day that they call for services. Now, that will be initially done by phone, but if we find that they have more critical needs, then we determine at that point whether they need to be seen face-to-face or through some other way. It's also important that medications are available. We have a lot of individuals who need these, and so, those that are needing injections or other medications are provided by appointments and often through drive-through clinics to allow for safe distancing. So no one is going without their needed medications, and this is really important for those who are fighting opioid or heroin issues.
Right.
Prior to COVID-19, our nation was fighting this opioid epidemic, and this did not go away with COVID-19. And unfortunately, over the past weeks, we have seen an increase in opioid overdoses. And I'm sure this is a result, too, as you were saying, as time goes on, these additional stressors are affecting folks in different ways. And so there's many ways that we continue to address this issue. First of all, we do provide the outpatient counseling and also have Suboxone services. And so those are done by appointment where individuals come in and can receive the medications and the appropriate screening that will need to occur with that. And, of course, we very much respect social distancing, again, to make those appointments happen. Narcan or naloxone, that is an emergency medication that is used for the complete or partial reversal of someone who's having an opioid overdose, and that's only until individuals can seek treatment from a physician. So it is really important, and our staff work really hard with individuals in the community. We work with faith-based communities or partners, the libraries, other county departments, so that we can provide what we call revive trainings, and this is teaching family members how to use this Narcan effectively on the spot if they have a loved one who experiences an overdose, and that will reduce the risk of the opioid death until somebody can then, call 911 and seek treatment. And so we have all kinds of trainings that are still occurring throughout this whole pandemic. We do a lot of the trainings virtually, but also on one-to-one measures so that we can use the appropriate, personal protective equipment or do whatever we need to make sure that we get this medication in the hands of individuals on the spot. And so, again, that does not take the place of the need to, seek treatment for these addictions. And we stand ready here at Mental Health Support Services to serve individuals at the time that they seek services, or if their family members call and try to get them in services again. People are available and ready to see them that same day. So just to give you, a couple of those numbers before I talk about some other things, if anybody is wanting to receive outpatient counseling and it's not an emergency situation, the intake number that we have is 768-7318. And then for those that are experiencing a psychiatric emergency, our emergency crisis line is 748-6356. But for the larger community, not just for those who are directly receiving our services, we have a whole prevention program who has been partnering with both the Chesterfield County's communications and media as well as the Chesterfield County Public Schools to develop a variety of video interviews. And these can be things on parenting tips or other mental health-related topics. And these are being placed daily. And so anyone that wants to go to the Chesterfield County Prevention Services Facebook page or the general Chesterfield County Facebook page will see a post at least daily on one of these types of tips. Now, you said it well when you said, there's as time goes on, folks are really feeling the effects of this, and it is very different depending on what the stressors are, for people individually. Some people are struggling financially the longer this goes on. People are still losing their jobs. We have, kids out of school and parents trying to homeschool at the same time. They're having to work, and whether that's working in the home or leaving the home to be on the front lines, there's just so many factors at play here in addition to the fear of acquiring the virus. And so it is so important that everybody is eating healthy, to keep your body in top working order. A huge one for me, and in doing this day in and day out, is monitoring your media consumption. Too much exposure to all of this on the TV or on social media, it can really be overwhelming. And so being able to balance this media exposure with other things that you enjoy, such as reading or cooking or listening to music, that really does help to kind of get you away from it and thinking more on, positive things. Taking breaks and exercising when you can, this reduces the symptoms of depression or anxiety that someone may be feeling. Getting out in the sunlight, Mother Nature wasn't too kind this morning, but, it's gotten sunnier as the day's gone on, and just being able to get out as much as you can, increasing that light exposure improves your mood and also will help with any symptoms of depression. those that are experiencing loss, a sense of hopelessness or social isolation, that really impacts someone's mental health. So finding ways for people to stay connected, is just so important. And even though it cannot be face-to-face, you can still be connected to family and friends through phone calls, text messages, video chats. People are still finding ways that, if they had book clubs or, online trivia games, all of those things can be done virtually now and still provide folks with the social interaction, as much as possible. I do know over this past weekend when I talk about experiencing, a loss or a sense of hopelessness, we had an increase in crisis calls from adolescents this past weekend because it was prom weekend. And again, that was a real sense of loss for a lot of these adolescents that they were not being able to participate in really the highlight of their school year. And so there was a lot of counseling and assistance that some folks needed to get them out of that kind of bad place that they were in at the time, and getting them into thinking about things more positive. But I think that, the key is really being kind to yourself. It is okay to have these feelings of stress and anxiety during this challenging time. I mean, we all are experiencing them in some way. We just need to channel these feelings in a positive way. And so hopefully through, the exercise, eating healthy, and some of the other ways to stay connected, that can really help with that.
Those are some great suggestions. Thank you. I am looking for, I went back looking for more information that I thought I had in a different file. Excuse me. I wanted to ask you a little bit more about some of the information that I see here, and I'm going to be just posting links directly from the Chesterfield.gov mental health support services page that you've got in here, because I think those are just some great links that are available for people. So I'll go ahead and add that to our live stream so that people have direct access to finding that. But I wanted to ask you, because you were talking about specifically about, kind of getting to this point where we're home with kids all day. Not only are we dealing with all of the things that are missing, but then there's all of the things that we're trying to change, because making that shift into being at home all day, making that shift into, for parents who aren't teachers, making that shift into managing somebody else's educational experience, and then, trying to be available to help them or teach them in whatever circumstance they find themselves. So I wanted to ask you a little bit deeper, getting into that, is there's some information that's provided on the website about talking to your kids about what's happening.
Yes.
And helping them kind of manage the sort of things that produce anxiety in adults.
Right.
It's reasonable to assume they would also have that effect on our children if they had the same level, if they had the same understanding that we did. So there's a way that we as adults can navigate how we not just carry ourselves, but how we talk to them about it, and giving them channels to talk about their feelings about that. Would you talk a little bit more about that? Because I think that's really pivotal. We're about a month, 5 weeks into this now?
Right.
So we've already gotten past the point where everybody's on everybody's nerves.
Right. Yes, it is important, and I want to do a shout-out to Whitney Kern from our prevention services, because she did a whole segment last week on, how to talk to your young child, and so that is on our website and accessible for folks to listen to that. It is important that we do listen to, our children and understand or try to understand what they're going through, but it needs to be on the level that they can understand. And so for some folks, really, what is going on, we need to keep them in a routine as much as possible, because, when people, even us, when we're out of our routines, we, tend to be off a little bit. So you want to keep them to their routines as much as possible. Trying to find the best way to tell them that, why they can't go to school. There's a virus out there. It could make people sick. It really depends on the age of the child. And then for those who are a little bit older, really talking to them or trying to help them find ways that they can stay connected to their friends, because they do miss that component, not being able to be outside playing or face-to-face, but finding other ways that can be managed, so that they still have that really important socialization that they're missing at this time. But again, really trying to get to the heart of what's wrong, especially when somebody's younger. It may be they're tired, they're hungry, really understanding what is making them so out of sorts. But the closer that we can keep individuals in their regular routine, given this new environment, is really best, I think. But, I want to touch on something because it's a sad topic, but it is a reality. And, as you can imagine, if someone is experiencing domestic violence in the home, their ability to leave the home and go to work or school really provides them that sense of security that they do not otherwise have. And so, unfortunately, with individuals remaining in the homes, the domestic violence calls have doubled. We've seen that in Chesterfield County as the stay-at-home orders and quarantining measures have taken place. So just as our services are available, the Chesterfield County's Domestic and Sexual Violence Resource Center is providing individual counseling and groups also in a virtual setting. And so I think it's important to just make sure that people know, for anyone that's, interested in individual counseling or has any, domestic violence concerns in that way, the number that they can call for that is 873-7887. Also, there are really sad, really extreme situations where someone is in need of a protective order or some type of safety planning or other, domestic violence needs. And so there's a specific number to call for that. That number is 706-2701. And, it's nice to talk about the positive and helping people through, but it is important for us to also talk about, some of these cases, have children in the home, and the children suffer abuse as a result. And so it's important that we know that our social services department, if anybody is concerned about welfare of a child, the number to child welfare or child protective services is area code 800-552-7096. And abuse in the home is not just limited to children. There's elder abuse and abuse of those with a disability. And so that number for elder abuse is area code 888-832-3858. So, again, I hate to, talk about that, but that is the reality as well.
It's definitely. Thank you. I know. I appreciate that because that's a huge part of, I think, one of the things that we see. We already live in a. I think, generally speaking, I think it's a fair thing to say that our society kind of lives in sort of a high gear. So we're already a little stressed out anyway. Most of us, the way that we tend to live is a little extra, trying to tuck more in, and to see any big shift in that is going to cause a lot of different ripple effects. One of them is going to be seeing that people's social skills and or self-containment skills are going to falter.
Right.
So that's fantastic information. I appreciate that. And I do have another guest calling in later this evening that's going to give us information about the whole region, talking about domestic violence in particular. But I really appreciate that you brought that up. I do have a question for you that I wanted to ask, because this kind of feels like we're kind of into the same sort of an area. Not just talking to your kids about what's happening, but as the disease goes on and as we are starting to experience some losses here in our area, I think it's inevitable to say that there's going to be a point where that's going to need to be addressed as well.
Right.
And I think one of the things that you said earlier, which I think is really important, is to limit your own exposure, because the less... I think when we're adults, we have this sense that having the TV on in the background is sort of soothing to have some sort of a chatter thing back there.
Right.
And then we feel like, and if something happens, I'll know.
Right.
But having that on all the time, generally for younger people, I think, it tends to heighten I think it does it for adults too. I just don't think maybe we're aware of it. But I just kind of want to alert people to that. So I thought that was a really good suggestion. But beyond that one, we need to navigate understanding, like, this, because it goes, helping people navigate the space where this is a little bit different than people getting sick. Does that make sense? Because we're looking at the potential, the potential for, or certainly what's happening in some other cities that we're seeing. Thank goodness that's not happening here, but still helping kids kind of navigate that space because they're going to hear it.
They are going to hear it, and they are they're likely going to experience it. I mean, we know that deaths have occurred, and we know that, just like any other death that would be in their family, some they can anticipate, some they cannot, and we have some really good resources that our prevention staff can help with about, explaining grief to children, helping them through that process. I mean, we do the best we can as adults, but again, if it's something very sudden and very tragic that they're not expecting, they're going to have a traumatic, experience with that. And so, I do think that it's important. I mean, we do our normal type of grief conversations with our children, but it is okay to reach out to the professionals and the prevention staff and get additional tips on that. It's just hard to know how people are going to respond. Everybody responds a little bit differently, and if it's a very close relative, if it's somebody in the same house, that's going to be a very different effect than those that we may not see as often. And that whole closure period, too, is very different. I experienced that firsthand with the death of a relative. It wasn't COVID-related, but it was my grandmother over the last week, and just being able to have a funeral was very interesting. It was, limited to 10 people, and you needed to be socially distant, and you couldn't have a funeral like you traditionally would. And so just having to go through that process and figure out how to say goodbye in a non-traditional way is just very different. And so
I'm very sorry for your loss.
No, I appreciate that. But, that's just what's so hard to just give a one-size-fits-all answer to some of this, because it is going to be unique depending on what the circumstances are. And, again, a lot of folks, if it's COVID-related and they end up in the hospital, you don't even get to go to the hospital to say goodbye in a lot of these, situations. And so there's a lot of, anxiety, a lot of guilt, a lot of feelings that you will experience that way by not being able to have a proper goodbye or be there, and you just feel helpless, in those situations. So, again, acknowledging that this, it's not your fault, it's just, as we say, the circumstances we're in, but then being able to talk through those feelings with others, and whether it's a professional or whether it is just someone else in the family. I mean, not everything that happens to somebody need to go talk to a professional. We know that. But if you have a strong, family support system, that is just, that's absolutely wonderful. But for those that don't have that, a lot of those feelings, they don't have a way to express that if they're socially isolated, and they really do need somebody else that they can share those feelings with and help them get through them.
Yep. All right. Thank you. I appreciate you taking the time to call in tonight. Was there anything else that you wanted to mention to our listeners?
I think I would just say, as my main message, try to find the good or what can be positive in all of this. There's so many things that we can do to help others or cheer others up. Checking on your neighbors, getting groceries for others. Those that we help benefit from these acts of kindness, and we also benefit, by doing something positive for others. And I think that I've seen a lot of that. You see a lot of it on the news. We see a lot of it out in the community. People riding by in their cars to cheer people up if they're sick or for birthdays. Just anything that we can do is positive. Just is really going to help us through this trying time. So,
I think that's a great suggestion. Wonderful. All right. For anybody who has just joined the program, this is my first guest has been Kelly Freed. She is Chesterfield County's Mental Health and Support Services Director. And thank you so much again for taking the time to call in tonight.
Thank you. I really appreciate it.
All righty. Have a good one.
You too. Thanks.